when I went to Saudi Arabia, my first 6 interviews were on Skype, which I hadn't done before. And if you've never done a Skype interview before, it's good to actually practice because you need to speak very slowly, think carefully about your answers. The people at the other end, here in the Middle East, may not be English native speakers, and you might be dealing with people with fairly thick accents, and things can get lost in translation. So it's very important to present yourself well if you're doing one of these early interviews. Wear a nice suit or wear some nice clothes. Don't be in your pajamas or like messy hair. Make yourself look nice, because when someone like me is interviewing you, if you're not looking professional right from the start, if I don't see it, the patients here expect the doctors to look extremely professional and act extremely professional. And that means not wearing some, weekend country check shirt and some loafers, or you really need to be very careful of your appearance as well as what you say. So that's something to consider when you're trying to go through the interview process here for the Middle East. And the next thing I would say is that in this recruitment process, we often see 10 or 20 or 30 or 100 CVs of fairly equivalent, standard clinical skills. But what really makes a difference in terms of who's hired and who's not is communication skills. It's having a flexible personality, a low drama personality. If you're the sort of person that likes to make complaints and make a fuss and difficult to satisfy, then the Middle East is not for you. You have to be very flexible here. You have to be a very good listener, and you have to think before you speak. And also you have to be able to take a few punches, take a few insults from time to time, have your pride hurt a bit, not respond respond in a very professional way, if at all. It's just part of living in a different culture. The way that management works here is often more authoritarian than in some of the Western places, although from what I hear of certain places around the world is fairly authoritarian, in various countries in the Western world too, but here it's fairly standard. So you have to be very careful how you speak to people, and always remember that as the Western trained doctor, you are held in very high esteem. People here, they take what you say very literally, and they remember everything you say. Don't make promises or guarantees that you can't keep. Don't make clinical judgments or prognostic assessments that are not realistic, because people will hold you to it. So it's very important to think very carefully about what you say. Give very measured answers. Don't lock yourself in on time frames. Don't lock yourself in on certain outcomes that you can then be held to account later, often in a fairly harsh way.